Welcome to week 9. We're going to talk about tobacco. Sugar may have been branded the new tobacco, but what about the original? You've probably all heard of the devastating effects that smoking has on the body. This slide describes all the various problems that have been linked with smoking or ingesting tobacco of any form. It affects all the major systems in the body, and there are always new diseases and conditions that are being linked with smoking, together with mental ill health as well. In England, from the fact sheets produced by the Action on Smoking, we have a huge proportion of deaths attributable to tobacco products. And this dwarfs the other major killers. And it's quite frightening that despite these statistics, we still have a high prevalence of smoking in the most deprived communities in our cities and countries of the world. If we look at that data in a slightly different way, i.e. the way that mortality is attributable to smoking in England, you can see by far the highest risk is of different cardiovascular diseases. And then you have all the respiratory diseases. Therefore, having a look at the bottom bar chart, you can see how much are associated with smoking from cardiovascular disease, respiratory disease, and cancers. The impact of smoking is devastating. In the UK, even now, over 200,000 children start to smoke. 90% are starting before they're 19 and a time when they can legally buy cigarettes. And 1 in 2 of them will die from a smoking-related disease. We know from all of the epidemiology that it's the poorest families that pay the highest price. To put some figures to this devastating set of diseases, we know it costs 13.8 billion to the UK economy, and that can be broken down into 9.5 for business, 2.7 for the local NHS, 713 from second-hand smoke, and then 507 million from house fires that could all have been prevented. For several decades now, we've been able to enjoy some of the benefits from having a tobacco control strategy. The history of this you can find on the website for the EU and tobacco control. This has resulted in a major change in how we view tobacco and smoking. And these include stopping the promotion of tobacco, especially to children, making tobacco less affordable through use of taxes and other measures that increase the price, effective regulation of tobacco products, being able to support tobacco users to quit, reducing exposure of second-hand smoke by reducing the places where people are able to smoke out in public, and then having effective communications as to why all the policies to do with tobacco control are important. This is data looking at England smoking of cigarettes by age groups. The good news is that the general trend between 1978 and 2012 is generally going down. However, in some of the groups, this is actually rising, especially in the latter years, and this can then be broken down into gender. And you can see from here the smoking prevalence rates by gender are all also dropping, but we have different levels for men and women. And in Greater Manchester, sadly, we've been seeing a rise in prevalence for males, and understanding why this is happening is very important. This is a study that we undertook for the EU Commission as part of the Framework 7 programme called EURO-URHIS 2. If you get chance, please have a look at our results website, where you can play with the data from over 27 cities across Europe and have a look at what's been happening with smoking. Sadly, this is data that shows in the youth, these are 14 to 16-year-olds, we had some of the highest rates of smoking at the first episode under 13 years of age. Going on to a global context, please have a look at the WHO tobacco control website. This can be found in your discussion board. Here's just one graph. It shows that nearly 2/3 of all the world's smokers live in 10 countries. This is frightening. Most of these countries are low and middle income countries where there are no tobacco control policies. Many of the companies that sell tobacco products, therefore, are targeting these countries as easy markets for them to get into. Frighteningly, this includes selling single cigarettes to children to get them addicted. And this is some of the next work that we're going to look at. Why is tobacco so dangerous? So there are lots of cancer-causing chemicals, toxic metals, and poisonous gases. This is data from the US Surgeon General, and it says that tobacco smoke contains more than 7,000 deadly chemicals. Hundreds are toxic, and about 70 can cause cancer. So why do people smoke when they know the risks? It's all to do with one of the most powerful addictive chemicals known to man, nicotine. This affects the brain in several different ways. And again, if you go onto the CDC website, you can learn more about this. The addicted brain causes several different biochemical and other changes that mean that smokers need more tobacco and nicotine to keep going, even with activities of daily life. There's a theory of what's called hijacked networks. So cigarette smoking and other tobacco products are then being associated with activities of daily life, and smokers that are addicted to tobacco feel that they cannot carry on without their regular tobacco or cigarette product. However, if you look at the benefits of quitting, we know that there's a significant increase in all of the positive effects of smoking cessation, even after 20 minutes. Things like your blood pressure returning to normal, having differences in the gas content in your blood, all the way through to having a risk similar to a non-smoker after stopping smoking from 10 years' time. We know that families are less likely to develop asthma and other respiratory conditions if the parents stop smoking. Children with non-smoke induced asthma can control their symptoms better. You're more likely to have a healthy pregnancy and baby. And the effects of secondhand smoke on friends and colleagues is significantly less. Therefore, if you stop smoking, you can save in England approximately £50 a week, that's rising now, and up to over £2,500 a year together with reduced insurance costs. We have a tobacco control plan for England, and this is just an exemplar. Please have a look at your own country's tobacco control plan. You should be able to find this on your governmental website, or some of the NGOs such as WHO will have the control plan for your country or your region. We're needing to see significant reductions in all of the people that are using tobacco products. We haven't spoken about e-cigarettes, but I hope this has given you a taste of how implementing evidence-based research into policy for tobacco products, and also the void of any tobacco policies, is actually causing an impact on behaviour, i.e. the prevalence of those people who smoke. What I'd like you to do is think about the evidence that we've presented here today. Think about the source of where I got you the data from. Did it matter to you? You also have had the opportunity to have a look at some of the other evidence presented, especially by Forest, that's the media arm of the tobacco companies. What do you make of all of these data? Who do you believe? And why is it that you believe a certain source over another? I urge you to always think critically. This is especially important for implementation sciences, where we're trying to put in evidence-based practice, both in healthcare, social care, and policy generally. Policies are vital. They can often mean that we are accused of being a nanny state, but the reason behind it is they actually protect the most vulnerable in our communities. These could be children, or the elderly, or the socio-economic deprived, and being able to do effective policy making through evidence-based research are the fundamentals of both implementation sciences and public health practice. I'd like you to have a look at this clip. I'd like you to think about how it made you feel and what you're going to do following looking at these pieces of evidence in terms of being able to provide a coherent message to implement tobacco control strategies in your country. It has been said if we have effective tobacco control policies, we could reduce global inequalities, reduce healthcare expenditure, and the devastating impact of the diseases associated with smoking on families across the world, globally and locally. So think about your part in all of this. And remember, after the Masters, you will be the people's advocate. Use your skills in being able to think through the evidence to be able to bring about change either in your local community, nationally, or internationally. If you believe in the evidence and you know where it's coming from, you can make a difference. Thank you.